Hey guys, this is Dr. Simoncini, Southeast Valley Urology, February 2020. We're talking about focal therapy for prostate cancer today. What's focal therapy? Well, traditional treatments for prostate cancer involve treating the entire prostate gland. Now, basically that usually would mean performing a surgery and removing the prostate cancer, or using radiation to eradicate the prostate cancer. We can also use technology such as cryosurgery, which is freezing the prostate. We've been through that era. We can also use high-intensity focused ultrasound to eradicate the cancer. Also very good technology. When we're talking about focal therapy, we're talking about just treating the one cancer lesion. Strangely enough, now this can be accomplished. You can kill cancer tissue in the prostate with either high-intensity focused ultrasound, which I think is the best of what I'm going to speak about, 2 laser therapy, or 3 cryosurgery. All those modalities kill prostate cancer. The question becomes, can you eradicate the entire cancer in the prostate with focal therapy, just treating the lesion? And what the answer really comes down to is we're performing more and more biopsies with MRI guidance, and even with that we have a lot better accurate biopsies and we have a lot better idea of where the cancer is. But the cancer doesn't grow in a discrete area like this. The cancer generally grows with fingers out like this. The problem is you can't really see that on MRI. You really can't get all those areas on biopsy to know exactly where the tumor is. So you have to treat a segmented lesion. And in theory this sounds fantastic because you're going to lessen side effects such as erectile dysfunction, incontinence. The downside is the results are reasonable with low-grade, low-stage disease, meaning very non-aggressive disease, but only reasonable. Now, is that really feasible in the United States or anywhere in the world? What you have to be able to do is trust your biopsy. Is your biopsy showing you exactly how much cancer is there? And some people would say yes, but I really do not believe that's the truth. And why do I say that? When we get our pathology specimens back from surgery, they rarely show less cancer than what's on the initial biopsy. There's usually more cancer postoperatively when you remove the entire prostate gland than what you know is there on biopsy. So, not surprisingly, the results from focal therapy are not as good as removing the entire prostate gland. Less side effects? Yes, absolutely. Same cancer control? Very doubtful. A lot of people argue that you can treat prostate cancer that way and watch it postoperatively, and as long as they're not having significant rises in the PSA or changes on repeat biopsy, that we can treat prostate cancer that way. I do not think we're there yet. As a community, I think more studies need to be done. I think in reality we would need better, more accurate, and conclusive biopsy and imaging studies before we can really look at focal therapy as a true option to eradicate all the cancer. Interesting topic though. Thank you. We're always here at Southeast Valley Urology trying to stay on the cutting edge. Come and see us in Gilbert.